Hello everyone, I'm Dr. Monica and welcome back to our tooth development series. In the previous video, we discussed the early bell stage. Today, we will continue with the advanced or the late bell stage where the tooth begins forming its hard tissues. So what is advanced bell stage? So advanced bell stage is the continuation of early bell stage where we can see that the specialized cells such as the ameloblast and the odontoblast, they now become fully functional and they start secreting organic matrix of enamel and dentin. So talking about two important structures and the advanced bell stage of tooth development. The first one is the enamel knot, which is the transient thickening of the non-keratinized cells in the inner enamel epithelium at the site of future cusps. So it acts as a signaling center and it regulates the growth and determines the number, size and shape of cusps. Second is the cervical loop. It is a band-like thickening of inner and outer enamel epithelium at the cervical end of the enamel organ. So cervical loop, it determines the future cemento-enamel junction and it plays a role in the root formation. Now let's talk about the major events that is seen in advanced or the late bell stage. So we can see there is transition from the cell differentiation to hard tissue formation by apposition and mineralization. Firstly, we have functional differentiation. In this, the odontoblast and the ameloblast, they become functionally active. Then the odontoblasts, they secrete pre-dentin, that is the organic matrix of dentin. Next we have is pre-dentin mineralizes and forms dentin. After this, the dentin acts as an inducer and stimulates the ameloblast to become fully active. The ameloblast then start secreting the enamel matrix, and the enamel matrix mineralizes and forms enamel, and this is followed by successive layering, that is apposition. In this, both dentin and enamel are deposited in successive layers over previously formed layers. Then comes mineralization of dentin and enamel, which begins after their deposition. So changes seen in enamel organ are stellate reticulum, it collapses, stratum intermedium remains active, inner enamel epithelium forms ameloblast, and oral outer enamel epithelium remains protective. So result is foundation laid for the formation of crown with enamel and dentin. Now let's talk about another important event that occurs in the advanced bell stage of tooth development, that is apposition. So what is it? It is a sequential deposition of organic matrix of dentin and enamel in successive layers. So each new layer is laid down over the previously formed layer. So the odontoblasts, they will secrete the first layer of pre-dentin, and the ameloblasts, they will secrete the first layer of enamel matrix. Next, a new layer of pre-dentin is laid down over the previous one, and the ameloblasts deposit a new layer of enamel matrix. And the same process continues, and we can see that there is successive layers of pre-dentin and enamel matrix which are deposited, which increases the thickness of the tissues. Lastly, the deposited matrices then undergo mineralization to become enamel and dentin. So coming to the changes in enamel organ during advanced bell stage. So with the onset of enamel formation by apposition, structural and functional changes occur in the enamel organ. So coming to the changes in the outer enamel epithelium, so it remains as a single layer of cuboidal cells and acts as a protecting covering and continues to separate the enamel organ from the surrounding mesenchyme. So coming to the stellate reticulum, so stellate reticulum, it begins to collapse and becomes compressed due to decreased accumulation of fluid in the intracellular spaces, and it brings the enamel organ closer to the dental papilla and blood vessels for better nutrition. So next is the stratum intermedium. It remains present and functional. The cells are more flattened and it plays important role in the nutrition of ameloblast and in enamel mineralization. So coming to inner enamel epithelium. So the inner enamel epithelial cells, they transform into ameloblasts. The cells become tall columnar with nuclei polarized away from the basement membrane, and they begin secreting the enamel matrix. So the odontoblasts, they are functional and they lay down pre-dentine, that is the first layer of dentin. So coming to the clinical significance of the advanced bell stage, so we can see that the apposition and mineralization of enamel and dentin begins in this stage. So any disturbance during this stage, it can affect the formation and quality of enamel and dentin. So any disturbance in ameloblast, that will result in enamel defects such as enamel hypoplasia, enamel hypomineralization, and reduced enamel thickness. And any disturbance in odontoblast can result in dentine defects such as dentine hypoplasia, poor dentine mineralization, and structural weakness. If you have liked the content, please like, share, and do subscribe to this channel. Thank you.